I joined Lakeview Clinic in the fall of 2025. My wife and I had trained in Omaha, and then we went back to South Dakota for practice for a couple of years to be close to family. And as things were progressing, we realized we would like to be closer to more family and also have more access to resources and things for my own family's healthcare, as well as be near my wife's family. So we ended up looking for a community that had access to resources, but we wanted something smaller that was family oriented, as well as had a really enriching community that cared about its community as well as its own development. And we were looking around at different areas and ended up coming and looking at Waconia and Lakeview Clinic, and really felt in love with this really charming community, as well as physicians that we met, and really found like we found our home. Medical and professional background is that I went to medical school at University of South Dakota, and graduated there in 2018, and ended up training at Creighton University down in Omaha, Nebraska. And that was an OB/GYN program that I really became in love with, and really felt supported, because it really identified the things that I find important, where I wanted good, all-encompassing practice, not only of obstetrics, routine obstetrics, high-risk obstetrics, as well as gynecologic medicine. And really it offered great full-spectrum GYN for medicine for all ages, including adolescents through menopausal medicine, which is something that I very much appreciate, and have heard and have found that is maybe not as well covered in other training programs. And that's something that I developed when I practiced in South Dakota. I ended up joining my dad's practice, and he was an OB/GYN for 38 years. And I got to work alongside him and see how he practiced, and was very honored and fortunate to inherit many of his patients and his practice, and got to develop those skills working through for full breadth OB/GYN. Everything from contraceptive management to infections to chronic pelvic pain, to endometriosis, vasomotor symptom and hormonal replacement therapy treatments, as well as a really full scope surgical practice. I'm a minimally invasive trained surgeon, and certainly became very proficient in laparoscopic procedures, as well as urogynecologic procedures, including anterior and posterior repairs, as well as incontinence surgeries. And that's something that I really enjoyed doing, because you can really make a huge impact in somebody's life in a matter of a day. I think for me, how things that really impacted me and how I learned to practice, and my philosophy of practicing, was really being a part of my dad's practice. And not only when I was his partner, but also as a student. As a student, it really impressed upon me what I would define as a physician. And he encompassed and became a role model for me, because of how he treated his patients, regardless of the issue that they came in with. Is that he took everyone so incredibly seriously, sat with everyone, and I think really truly tried to hear what they were saying. And that's something that is not always found in healthcare, unfortunately. And that's something, regardless of my day and things, is that I try to devote my time to each patient that I see, and really try to figure out, why are we here, and how can I best approach them and help them. And seeing him interact with his patients really impressed upon me that importance. And really probably what has really shaped me too is seeing how those relationships developed from somebody's confirmation obstetrics appointment, where they found out they were newly pregnant, to growing with that patient, and hearing these stories of somebody that has had all of their babies with this particular provider, and now is seeing them for their annual physicals. And that's something that relationship is something that you don't find every day. That really is huge for me. Routine physical visits, and really how I would approach an office visit, is number one, is trying to establish a rapport with somebody, you know, and again, I want to make sure that their voices are heard and their concerns are heard. We try to figure out our goals for the visit, whether that is addressing a particular problem or checking in for just an annual physical. But we will review their concerns, develop and review systems, perform a complete physical exam, and really from the framework of patient autonomy, meaning that it is a patient-driven office visit or appointments, that we will figure out a strategy and a game plan that will work for them. If you've never seen an OB/GYN before, I think you're going to be surprised at the providers and their personalities. I think that we're a fun group of people, and I think that you'll be surprised at how quickly I hope that we will establish a connection with one another. That we make conversation. We want to get to know you. We want to get to know your concerns and really develop that relationship. OB/GYN and women's health perspective for practicing primary care, I think we offer a lot. Not only the relationship aspect of growing with a patient and truly becoming familiar with their medical history, but also I think OB/GYNs are good detectives, and we have to be good detectives for treating obstetrical patients, treating gynecologic patients, that we work with them to find out, to work through their problems and figure out how we can best treat them. I think that OB/GYNs are really uniquely apt for that particular job because, again, we develop these relationships with these patients over a long period of time. Shared decision-making, I think, is paramount for how I practice. When I meet with somebody, we try to figure out a priority for their visit, their game plan for the visit, as well as what, setting our expectations on what we may be able to attain together. I think patient autonomy is incredibly important in healthcare, and really trying to emphasize shared decision-making on how somebody will develop their own healthcare. And I'm a big believer in patients owning their healthcare, that it's important to me that when somebody comes in with whatever medicine they might have or problem that they might have, that they really understand why they're taking it and why their treatment plan is as such, so that they have a full view of what's going on in their life. I myself am nervous at my own appointments. I'm wondering what my blood pressure is or what will come of the day. And I think the important thing to remember is that our appointments are a safe place, and that we really want to approach this from a team point of view, that we're going to work together and try to figure out how best to treat the patient, and that we're going to try to do that in a very comfortable manner and obviously in a safe manner. I think all patients, before they come in for their OB appointment, should come with questions. And I think it's great that people come with questions, and they will do reading beforehand, and they'll come with ideas, because I like our appointments to be a conversation. I think at OB/GYN we have to be a very accommodating type of physician, and we need to work together to help somebody through their prenatal journey, working towards that happy delivery, obviously. But I like that when people come in with questions and they have ideas and they want to talk about things, and sometimes we need to pivot, we need to navigate things. But I also think that's what I'm here for. That's what your OB is here for, is that we're resources to help figure this out. I want my patients to feel how I feel after I leave my appointments, that we might not know exactly what's going on, or we might not have a definitive plan when we leave on how to treat or cure, but I want patients to know that we have a journey, and we have steps moving forward to figure out how to best address their problems, and that I want patients to know that they are well supported and that they are heard when they leave our appointments, that together we're going to figure out how best to treat you.